Madam President, I rise today to talk about a tax increase in the President's Affordable Care Act. I want to start, though, by commending my colleague from Florida for his remarks regarding the Zika virus and the impact it's having, not just on his state, but on so many others in our country. And I thank him for his diligence in trying to get to a solution. And we're so close. We did pass something here in the Senate. The House passed something a little different. It's time for us to figure out how to resolve these relatively small differences and provide the help that's needed. This is an emergency. It's a medical emergency. I was on the floor yesterday speaking about another emergency, which is the opioid issue and the heroin and prescription drug addiction and now fentanyl addiction issue that's facing Ohio and so many other countries, so many other states in this country. So these are both issues that I hope Congress will act on as part of the process of being sure that the government is funded at the year end. And again, I commend my colleague from Florida, Mr. Rubio, for his good work on this. Again, what I want to talk about is a tax increase that's actually in the Affordable Care Act. This is a tax increase that many people don't know about, but sadly, it goes into effect at year end and is going to affect a lot of middle-income seniors in Ohio and around the country. There are millions of seniors who are potentially vulnerable to this tax increase. Some of them don't even know about it. It comes at a time, by the way, when middle-class families all around this country are feeling squeezed. And it's those very middle-class families who are going to be hit hardest by this tax increase. Let's face it, wages are flat, even declining on average when you take inflation into account, whereas the cost of living has gone up, hasn't it? And there's a number of factors to that. Electricity costs have gone up in my home state of Ohio by about 25% in the last several years, for instance. But with regard to health care costs, there's no question that everybody's experiencing an increase. Families, small businesses, seniors. The President's health care law, the Affordable Care Act, of course, was advertised as helping on that. The notion was, as was explained at the time, that there'd be about a $2,500 per family decrease in the cost of health care premiums. That hasn't happened. In fact, costs have skyrocketed to the point that for many people, it's their biggest cost increase, and they simply can't afford health care coverage. It was supposed to bend the cost curve and bring health care costs down. It hasn't. The Ohio Department of Insurance just did an analysis. They say the average cost of health care insurance premiums for the individual market in Ohio has increased over the past 7 years by 90%. 90%, almost a doubling. When you look at the Affordable Care Act exchanges themselves, it was just reported that we are expecting a 12% on average increase, 12% on average for people in the exchanges. Who can afford that? This is a double-digit increase. The result, again, is people are feeling the squeeze. Wages flat, expenses up. There's a survey that was done by the Federal Reserve recently that said about half of all Americans say they have to borrow money or sell something to cover a $400 emergency expense. $400. If you've ever had a health emergency, and you know that can catch you by surprise, it can happen to anyone. Trust me, it usually costs more than $400. Seniors are especially vulnerable to these expenses, particularly seniors who are on fixed income. One economist testified to the Senate Finance Committee at a hearing we had that, in part because of these unexpected health care cost increases, more than 85% of Americans are at risk of having insufficient income in retirement. More than 85%. And we think this middle-class squeeze is going to get worse, not better, in Ohio because so many companies are pulling out of the health care exchanges. So in Ohio, 6 of the 17 companies that offer health care on the Ohio exchanges have now decided to pull out because they're losing money. And Aetna is the most recent one. This means, of course, less choice. And when you have less choice, what happens? Less competition. Less competition, what happens? You tend to have higher costs and lower quality. So this is going to make things even worse. The Congressional Budget Office, a nonpartisan group here in Congress, and the Joint Committee on Taxation project that health insurance premiums over the next decade will continue to grow at about 5% per year on average. So that just steady increase is just impossible for people to be able to afford. For seniors, the Medicare trustees project Medicare's monthly Part B premium and deductible will increase even faster than that, by about 5.5% per year. And again, for a lot of people in that situation, they're on a fixed income. Their income's not going up 5.5% per year. One way seniors have found relief from the squeeze, of course, is to take advantage of what's called the medical expense tax deduction. And it's really very simple. It says that if your medical expenses exceed 7.5% of your income, then you can deduct all those medical expenses. And a lot of seniors take advantage of that. Again, what a lot of seniors may not know is that as of the end of this year, under the Affordable Care Act, it increases, that threshold increases from 7.5% up to 10%. What does that mean? That means a lot of middle-income seniors are not going to be able to deduct their medical expenses because they exceed 7.5%, but they don't exceed 10% of their income. And there are about 10 million Americans who use this deduction every year, by the way. Most of them are seniors. A lot of them make less than the national average household income. Most, in fact, make less than that. Of course, a lot are on a fixed income. I've met with some of these people back home who are directly affected by this. One would be Susan Culbertson. She's from Zanesville, Ohio. I was with her in Columbus last week. Susan said she started working when she was 14 years old, and she contributed to Social Security. She thought she had a decent plan for health care with Medicare and being able to take this deduction. Now, as a senior citizen, she's got a chronic illness, and she's losing sleep on how she's going to pay for all her medical bills if this threshold goes up to 10%. Her husband, Michael McVicker, worked as a substance abuse counselor in a school. He's now living off Social Security. And boy, that's hard to do, as seniors will tell you. When he had a heart attack a few years ago, the medical expense deduction helped him. It helped him and his wife, Susan, be able to stay afloat financially. The difference between this 7.5% and this 10% may not seem like much to some people, but it matters a lot to Susan, to her husband, Michael, and to so many other seniors in Ohio. I met with Lanny Hawkins. He's from Ontario, Ohio. He volunteers to help seniors do their taxes. God bless him. That's a hard job because the tax code's gotten so doggone complicated that people need help from these advisors. He tries to help them walk through the tax code. He told me that in his experience, the medical expense deduction is especially helpful to seniors who have just lost their spouse. He says then only one income is there, and often they still have to pay their spouse's medical bills after they're deceased. So in his practice, he has found a number of people who fall between that 7.5 and that 10% number who are in that situation. By the way, I was supposed to meet with somebody named Regina George. Regina's from Hamilton, Ohio, to talk about this very tax increase. I was looking forward to it, but she couldn't make it. And you know why she couldn't make it? Because of the very health care problems that we're talking about here. Regina just had triple bypass surgery, and she's got a broken hip. She's got some out-of-pocket expenses. She has to depend on her son, who lives with her. Her out-of-pocket health care costs each month are increasing. She's very worried that it's going to exceed 7.5%. But not exceed 10%, and she's going to find herself in a situation where she cannot deduct these health care expenses. The Ohio AARP has done a good job of providing specific information on this to me and to other members of the Ohio delegation. That's really helpful, because this is just not about numbers, this is about people. And when you talk to these people and see what they're going through, I think it's something that Republicans and Democrats alike should be able to come together on here to solve before we leave during this session of Congress. The data from the Internal Revenue Service shows that seniors who use this deduction, by the way, tend to be the oldest, the least healthy, and, by the way, disproportionately women. Think about it. To have medical expenses above the threshold means you either have to have low income, high out-of-pocket medical expenses, or both. These are not folks we should be raising taxes on, especially not now when they're feeling squeezed. Even with Medicare, as I said earlier, seniors still spend a large percentage of their income on health care. The average Medicare beneficiary spent more than $6,000 a year in out-of-pocket health care expenses in the last year we have information for. The result is that some 8.3 million seniors rely on Medicaid in addition to Medicare. And while this billion-dollar tax increase we're talking about today is intended to pay for part of the president's health care law, it could actually, in the long run, cause more strain on an already struggling Medicaid system. I think that's sort of the definition of penny wise and pound foolish. Another reason for us to pass this legislation. Again, not about numbers, it's about people, some of the most vulnerable in our communities. That's why Senator Brown and I have introduced this legislation. It's called the Senior Tax Hike Prevention Act, to block this tax increase from going into effect at the end of the year and to extend the current 7.5% threshold that so many seniors are counting on. The bill is bipartisan, it's common sense, and it's a chance for this body to show that it does work for the most vulnerable in our society, that we stand with middle-class families who are feeling squeezed right now, and that we stand with our seniors. I want to thank Senator Brown for being an indispensable partner with me in this effort. I also want to thank the many supporters of our legislation, like the AARP, the American Senior Housing Alliance, and the Ohio Alliance of Area Agencies on Aging. I urge my colleagues to join me, join Senator Brown, join others, and join all these organizations that represent millions of seniors in blocking this billion-dollar tax increase by supporting this common sense legislation for the sake of those seniors who are caught in the squeeze, those seniors who we represent. Thank you, Madam President. Yield back my time.